medication, specifically the liquid medication preparation, we throw the excess medication on the sink properly. Then, we wipe the medication cup with a paper towel so that we don't contaminate what is inside that will be given to the patient. Another technique in making sure that you prepare the exact amount for a liquid medication, we use a 10 ml syringe without needle. Here it is. So, here's the medication. Again, when you open it, you make sure that the cup is turned upside down. Then we aspirate this one, withdrawing the exact amount to be given to the patient. So that is another technique of measuring the medication, especially for pedia patient. Also, when preparing medication, especially those oral medication, you also check the expiration date of each medication. It is important because it may cause harm or may not have desired effect to the patient if you give an expired medication. So, also, you have to consider comparing the prepared drug with the container. As I mentioned earlier, you make sure that the medication card is the same as the medication that you are about to give to the patient. And never leave the prepared medication unattended. And now we're ready to proceed to the patient. Okay, now we'll be proceeding to the administration of medication to the patient. Good afternoon, Mrs. Chase. I am going to give you your medication. Compare name on record with patient's ID, and for a more accurate way of identifying the patient, we may ask the patient herself or himself their name. Hey ma'am, may I ask for your name? Yes ma'am, you are about to take your medication. This is paracetamol. This is for your fever. Thank you ma'am. For the proper administration of drugs, we will assist the patient to their comfortable position. Ma'am, may I ask you to sit? Are you able to sit? Thank you, ma'am. The patient is comfortably sitting, and we make sure that no aspiration will happen. We will have the client hold medication in their hands so that they will be the one to administer themselves the medication. So, ma'am, will you able to hold this? Okay, we make sure that if ever that they cannot do it themselves, we help them to take their medication, but make sure that aspiration is prevented. Offer fluids to aid patient in swallowing the medication. So, Mrs. Chase, would you like a water? For sublingual medication, you have to tell the patient to place the medication under their tongue until it dissolves, and you have to tell the patient to avoid swallowing it. So, Mrs. Chase, one of your medications should be given to you sublingually. So, may I ask you to put this medication under your tongue and avoid swallowing it. And I will give you the medication for you to put it under your tongue. Okay, thank you, Mrs. Chase. Also, no fluids will be given to you as of the moment, but later on, after it dissolves under your tongue, then I will give you the fluids. On the other hand, for a vocally administered drugs, you have to tell the patient to put the medication against their cheeks mucous membrane until it dissolves, and same as sublingual medication, fluids should not be offered. So, again, Mrs. Chase, with this drugs po, you are to put this on the side of your cheek. You don't have to swallow it yet. You let it dissolve there. Then I will give you the fluid after it dissolves also. At the side of your cheek. Okay, until it dissolves. For powdered medication like this, we have to mix this with liquids at the bedside already. You don't have to prepare this earlier because it may harden and it may cause difficulty for the patient to swallow. So, we may ask the relative or the patient themselves for a cup of water to dissolve this. Mrs. Chase, may I ask a cup of water? We will give you this mucolytic for your cup. Thank you. Then you dissolve it here and you make sure that it is properly dissolved before giving to the patient. Mrs. Chase, would you like to take this? Thank you. Thank you. After giving the medications orally, make sure to stay by the bedside of the patient until he or she has swallowed all the medication. You don't leave the patient immediately, or you don't leave medication to patient just by instruction. So you make sure that the medication is taken by the patient itself. If needed, you may ask the patient to open their mouths to make sure that no medication is left inside the mouth. So Mrs. Chase, may I ask if you are able to swallow all the medication I gave you? Can I see your mouth, please? Thank you. Everything is swallowed. Thank you, Mrs. Chase. In administering highly acidic medication, we may also give a snack to make sure it will not be harmful to the gastrointestinal tract of the patient, but only if it is not contraindicated. So, Mrs. Chase, how was your tummy? Do you feel any acid, or do you feel like vomiting, nauseated because of the medication? You may have a snack if you like to. Thank you. Administering the medications to the patient, you make sure that she will be put to her or his comfortable position. So, Mrs. Chase, I would like to assist you again for your position. Would you like to lie down now? Okay, I will help you. Are you comfortable? Would you like me to cover you with a blanket? After administering the medication, we make sure that we discard the soiled supply to the proper trash can. So we have here this one. So these are non-infectious, and we may discard it. Then we'll be proceeding with the hand washing afterwards to make sure that there is no transmission of microorganisms. Then after discarding everything, we have to return to the patient for evaluation. Hi, Mrs. Chase, how are you feeling? How did the medication affect you? Do you feel fine? Do you feel any difficulty of breathing? Itchiness? Nauseated? Thank you, Mrs. Chase. After evaluating the medication effects to the patient, we are now going to record the medication that we have given to the patient. So here's the medication, record here, and the name here, and the initial of who gave the medication.